Here we have an aspirating syringe. This is for giving injections prior to dental treatment. Pretty much every single person who has any kind of treatment will have this type of injection, and you will be responsible for setting this up for your doctor, although you won't be responsible for giving the injection because we're not supposed to be doing any of that. So we have aspirating syringe, we have a long needle and a short needle here, and a PDL needle here. The long needle is for IA blocks. This is for the lower jaw in the back. It's longer so it can reach far enough back. The short needle is for infiltration and mental blocks, also for palatal injections. This would be on the top teeth or the lower. The PDL is for PDL injections. That's into the sulcus of each individual tooth. Okay, so for loading our syringe, we need to be careful of a few things. These are sharps. If we're not careful with them, they can poke us, okay? Not just the needles themselves, but also the syringe. Lots of people don't realize that this little spear here can and will poke their thumb if they're not careful. What people do is they put their thumb on this thin part right here, and then when they go to move this, it slices their thumb. So be careful of this right here. It can hurt you. All right, the first thing we need to do is get out. Oh, I have an anesthetic carpule right here. All right, in your non-dominant hand, mine is my left, I hold the syringe. You need to hold it so you can operate it and pull this back without using your right hand, because your right hand will be busy. So I hold it like this, and then I grab around this little ring, and that way I can pull it. All right, the first thing I do is I load my anesthetic, and then I give it a little tap. This spear needs to go into the rubber plunger. Okay, the rubber plunger goes into the spear. The gold is where the needle goes in the top. So like this. Then you give it a good couple taps on your hand. Should have a decent amount of pressure. You can check to make sure that the plunger is in there by pulling back gently, and the anesthetic should move with it. This is because we need to make sure that we don't inject into the patient's bloodstream. The dentist, when they inject into the patient's mouth, will pull back, which is aspirating, slightly, and if blood comes into the anesthetic, they know that they've hit a blood vessel and they have to move a little bit. So it is important that that plunger's in there. We put this down, okay? We open up our needle on the portion that goes into the syringe. All you have to do is just pull straight. Don't have to twist or anything like that. The white cap will come off. Okay? We hold this with our dominant hand between our first finger and thumb. We hold our syringe with our left hand. Okay, and then this is very important, we use a fulcrum. You need to be touching with your pinky the syringe. You very slowly and carefully guide the needle into the anesthetic. Then you push down as you twist it on. It's always important that you're pushing down on this cap because it will come off very easily. All right, now we have our syringe completely loaded and ready for the doctor, right? We want to practice uncapping and recapping our needle. Although it's not our responsibility to do this, it can happen on accident. It's important that we know how to deal with it when this happens. So you just pull straight, very confidently. When if you pull it off, don't freak out and try and put it back on. You could accidentally poke yourself. So you need to just, if it comes off, just be confident that it's going to come off and that you're going to be okay. You put it on the table. Then you do a scoop method. So you never touch the cap while you're recapping it. You always scoop into it. Once you're 100% sure by lifting it up that you have it, you put this back on. You never ever put it back on with your finger on top. Always your fingers on the sides. You need to be careful and protect yourself. Okay, so that's an uncapped and recapped syringe.